Hello, this is Dr. Lewerenz, the Longevity Health Institute. This evening, I'm in Rochester Hills in our office. It is Monday, the 14th of November, 2022, and I want to share with you some info and some short details and help with POTS. Possibly you have or heard of a term called POTS, or not only you or your family or friends may have something like this. You've heard this weird term, but what does POTS stand for? But also follow me, subscribe to our channel. I'm going to give you help with this at the very end about some simple tricks and things that can help in understanding POTS, but also we reverse and fix POTS here all the time. So remember that, so share this video. What is POTS? Well, it stands for positional or postural, depends on lay terms versus medical, orthostatic tachycardia syndrome. So in lay simple terms, what this means is that in certain positions, you get low blood volume, low blood pressure, tachycardia meaning increased heart rate, okay? And it's a syndrome. And what do syndromes mean? Well, syndromes are not diseases, so this is really hard to always pinpoint and diagnose patients, and often these patients will fall through the cracks and be underappreciated or misdiagnosed. And that's why I want to do this video and share this with you, because there's some simple things to look for to understand whether it's yourself listening or whether it's somebody that you're suspicious of. Now, let me give you a little bit of background data on it. Is that approximately 1 to 3 million people in the US have this diagnosis yearly. It is more common in women. It is more common in younger population. Usually you grow out of this as you get older. It's very, very common in fit people, athletic people. So a very common scenario is a young female that's fit and athletic, okay, that has this type of syndrome. Again, postural orthostatic tachycardia syndrome, and often explained by being positional. But anyway, what does it mean? Well, the major symptom is dizziness, fatigue, gonna pass out, high heart rates, feel like they're gonna pass out or have passed out, and also it accompanies anxiety. Now, sadly, I've had patients come in here that have really struggled with this for literally years. They've gone to ERs and doctor's offices and they get dismissed. And this is super frustrating for me because it's so underappreciated and so insulting to be dismissed as a psychiatric or a psychotic event and just say that it's anxious or anxiety or they're having panic attacks, okay? Well, that's fine when you rule out things, but postural orthostatic tachycardia syndrome can accompany anxiety, of course, because these people have high heart rates for no known reason, and they're also potentially gonna pass out or feel like they're near passing out, okay? Now, symptoms often, though, accompany this are, again, higher heart rates, higher resting heart rates. When they get from lying to standing or sitting to standing, their heart rate in an unexplained significant amount goes up, elevates a lot. So we're not talking goes from 50, 60 beats to 70, 75. It'll go to 90 into the hundreds, okay? Often this can accompany a lower blood pressure, okay? And again, so somebody that's fit, that has low blood pressure, potentially has low blood volume. That's why dehydration can play a role here, okay? But they have low blood volume, higher heart rates, and then positions of lying, sitting, standing, they feel like they're gonna pass out. Blood pools into the legs, their heart rate tries to pick up even more to sustain function, okay, meaning blood flow and oxygen to the brain, okay, into tissue perfusion. And what happens is that high heart rate cannot perfuse the brain and body, so they get dizzy and they get that feeling of passing out. Now, sometimes it accompanies other symptoms. These are less common, like chest pain or chest squeezing or tingling or numbness and that, but it can lead into definitely anxiety and panic because of these unusual feelings or symptoms. Now, in the practice here, we do see this often when people are, a little bit because of this happening and underdiagnosed and misdiagnosed, and they've been dismissed or they've been tried to put on a anti-anxiety med or an antidepressant medication, okay, which does not solve the problem or the symptoms, then what happens is that, well, now they have the side effects of that medication, and I promise you, you're not Zoloft, Paxil, Lexapro, Wellbutrin deficient. I promise you, okay? That's another topic. But the point being is that you treating the problem will solve the POTS and then usually get rid of the anxiety, okay? But again, this can accompany anxiety or hypersensitivity, if you will, to situations. But again, what are some simple things? Well, here in our 6-point model, when we unravel the onion of your health and your health foundation here at Longevity Health Institute, and we grow you young and make you thrive, not just survive, okay? One of our systems is your hormonal system, and that has to be truly appreciated when you're dealing with POTS, okay? Because your hormonal system, that is the base of your pituitary, your adrenal gland, which also signals to your thyroid, your pancreas, okay, and your other endocrine organs. The point being is these are often issues when you have an autonomic dysfunction like POTS, okay? So hormonally, what can we see? Well, you can have adrenal fatigue, which what will that cause? That will cause higher heart rates, lower blood pressure when you have adrenal fatigue, not just stress where you're pumping out a lot of cortisol, but where the cortisol drops because you've had chronic stress, okay? And again, those higher heart rates, lower blood pressures, when there's an adrenal fatigue person, and again, what are those symptoms? They're going to be POTS-like symptoms, but they're also that patient's going to be fatigued. So you have to appreciate someone's hormonal system. If you have POTS or suspicious of POTS, get your adrenal glands checked. Best way to check is a salivary diurnal spit test where you do 4 points, morning, afternoon, evening, and bedtime, and we can see the pattern of your cortisol and your adrenal function throughout the day. Now, deeper than that, and what's the cause often of that, is your hypothalamic axis. Okay, so your HPA axis that signals from your brain and affects the vagus nerve and your autonomic nervous system, which is connected to your adrenals and vice versa, okay, is usually the root cause of often a lot of adrenal stuff, okay? So your autonomic nervous system is an automatic nervous system, meaning you are not consciously in control of this, okay? It is what's causing you to take a breath. You don't have to think about your heartbeat. You don't have to think about blinking to keep moisture in your eyes, okay? These are automatic or autonomic things, okay? Well, this gets dysregulated with your vagus nerve and your hypothalamus and this HPA axis of signaling to your adrenal glands, okay? Biggest nerve in your body is your vagus nerve, from essentially down your body, lower gut, all the way up to your brain, okay? And HPA axis and vagus nerve issues come from chronic stress. Your body knows no difference in stress, no matter if it's good stress or bad stress. Watch my other videos about adrenal function, okay? But stress is stress, okay? And when your vagus nerve reacts and your hypothalamus and your pituitary react, okay, these can cause autonomic dysfunctions and will lead to POTS. So how do you get and unravel and resolve and yes, reverse POTS? Is you get somebody's vagus nerve and their HPA axis to calm down. You work on things like breathing exercises and meditation and cold showers and cold baths and cold face dips and yoga and things that are calming to the adrenal system, de-stressing, good deep sleep, at least 1.5 to 2 hours of delta deep sleep, okay? You can document that by some of our health systems that we use, like an Oura Ring or a Fitbit or a Whoop strap, okay? But the point is that you're fixing your HPA axis, you're addressing and fixing your adrenals, okay? And you're appreciating, though, so I don't leave anything out, all your other hormonal systems. Because one thing I see often is, remember, who's the most common person with POTS? Remember I said this? More common in women, more common in the youth, more common in fit people and athletic people, okay? And often these will accompany skinnier, smaller people, so they have lower blood volume, okay? And remember I said they're athletic, okay? So dehydration at times can play a role, okay? But that person, who does that fit? Well, that fits an athlete. And athletes often have higher androgen hormones, okay? DHEA, testosterone. And to complicate this even more, it is even potential that they have PCOS, okay? Another topic, that's why it's important to subscribe and watch all my videos. I try to keep them short but precise, okay? But you need to appreciate your hormonal system and your testosterone, even if you're a woman, because that androgenic, and that, if you will, that androgen hormone, that pump, that kind of strength, that fight or flight, can also be exacerbated by the excess of testosterone or the imbalance of testosterone. So you can actually have a big imbalance in your HPA axis, your vagus nerve isn't firing like it should, or it's not in balance. You have high testosterone potentially, or high DHEA, okay, and chronically low cortisol from adrenal fatigue. You can have lower blood volume, okay, and lower blood pressure, and you're going to present as POTS. Another interesting thing is this, is when testosterone in a woman, technically in a man, when it's really excessively super physiologically dosed, we don't do that, but when I have like a bodybuilder come in, of course they have anxiety and panic and irritability and all that, because they have too high a testosterone. Hormones have to be done in balance, okay? When they're done in balance, things are not only healthy, but that's how you thrive and survive, but with being healthy and being preventative, okay? But what does high testosterone in a woman do? And a man technically, but in a woman, remember that female young athlete? Anxiety. It'll make them have higher heart rates, sweat a bit, feel nervous and anxious, okay? So you can see how all these things can lead to under or missed diagnosis, and also for someone to fall through the cracks, okay? Here at Longevity Health Institute, again, I'm going to give you some final tips, but we address POTS, we reverse POTS, we appreciate it, okay? So if you're out there and experiencing anything like lightheadedness, dizziness, have had passing out episodes, are fatigued or weak, going to the ER for visits and not getting good answers, being told potentially you're just anxious and panic and you need a anti-anxiety med or an antidepressant, okay, pump the brakes, come see us. Our functional personalized medical approach will reverse all of this, okay? It just has to be addressed right in a precise, personalized way, okay, to fix. Now, a couple things you can do. Drink plenty of fluids. You want to keep your blood volume up, okay? Hydrate. The other thing you can do is good sleep, okay? Your autonomic nervous system works more efficiently and more effectively when you have good 7-8 hours of sleep, especially getting an hour and a half to 2 hours of deep sleep, okay? The other thing you can do is meditate, calm yourself. If you have high stress, okay, and if you're an athlete, sometimes that means backing down the exercise, checking in with yourself and really having a good conversation with yourself about maybe I'm stressing myself too much with exercise. Maybe I'm hitting it too hard and you need a little bit of down regulation of that, okay? The other thing is supplementing with a Mediterranean or a pink sea salt or Himalayan salt. A good mineralized salt helps your aldactone hormone, but it helps you hold more blood fluid volume so you can hydrate better, okay, and hold fluid more, and that actually helps the blood pressure stabilization, and then the minerals can help your adrenal gland and also your vagus nerve signaling, okay? So those are just some simple tips, okay? Postural orthostatic tachycardia syndrome, okay, is fixable, is addressable. Here at Longevity Health Institute, we're happy to help you with this. Subscribe to our channel here on YouTube, follow us on Facebook, follow us on Instagram, and we're here to help you. And we're always accepting new patients, me and my providers. Just recently actually bringing out a new doctor, excited about that in 2023. So listen, we're here to help you. You're not alone. We can fix POTS. Be well.